Good evening to everyone, and welcome to the Macedonia Baptist Church of East St. Louis, the church for all generations. I am Reverend J. Kevin James Jr., the senior pastor here at Macedonia. And what an awesome opportunity it is for us to share together tonight in the sake of having conversation around COVID-19 and our vaccine. So I want each and every one of you to do me a favor right where you are in the virtual space, whether on YouTube or on Facebook. I want you to go ahead and share this live. Share this live with your family, with your friends, with people who may have some questions and want to know what's happening with the vaccine and just want to be a part of this conversation. I want you to go ahead and share this on your page. Tag some of your family and your friends, tell them to come on in the room, start a watch party. But we want you to be a part of our conversation tonight for our evening with Dr. Ezike. So again, go ahead and share that. I'm also going to ask if you would, in the comments section, tell us where you're watching from, whether you're watching us in the state of Illinois, or you're watching on the Missouri side, or maybe you're watching in a whole completely different state, or maybe even country. We want you to let us know where you're watching from as we are going to have a great discussion tonight. Before we begin, there's a few things I want to share with you all as a family of faith. Some initiatives that we have going on and taking place here at the Church for All Generations. As many of you know, tax season is coming up. And we are preparing here at the Macedonia Church to provide free tax preparation. And so we're asking that those of you who would like to receive this information, maybe you want to help and be a part of our free tax preparation, please feel free to email Sister Patricia Williams or call at the church for more information. Also, we want to share with you our Village e-learning support program, which is servicing our students in Illinois and in Missouri. We are now looking to shift to our after school program as our students are heading back into the classroom. And so we want to continue to provide that space, but we need your help. And so we're asking if you would like to be considered as a volunteer, please reach out to us at the church or email us at mbcchurchoperations@gmail.com. Lastly, I want to encourage you. We are a church that believes in the power of prayer. And beginning next Thursday at 12 noon, we're going to have what we call our lunchtime refuel. It's an opportunity for you to join us in intercessory prayer every Thursday at 12 noon on our conference line as we stand in the gap for one another, as we stand in the gap for our country, our state, and our community. So we want you to be a part. Also, if you have not had the opportunity to connect with us, please like our Facebook page. Also subscribe to our YouTube channel at J. Kevin James Jr. Ministries, as we would love to be in connection with you on this spiritual journey. Well, listen, let's get ready and let's get this thing started tonight. And I have the distinct pleasure of introducing our guest for this evening's conversation, and that is Dr. Ezike, who is the current director of the Illinois Department of Public Health. She is a board certified internist and a pediatrician who came to the public health department from Cook County. Dr. Ezike has served over 15 years with the Cook County, promoting the organization's mission of delivering integrated health services with dignity and respect, regardless of a patient's ability to pay. Dr. Ezike has graduated with honors from Harvard College with a concentration in chemistry. Her medical degree is from the University of California at San Diego. She completed her internship and residency at Rush Medical Center, where she is an assistant professor of pediatrics. She also earned a management certificate from Harvard Business School. Listen, Metro East, we are blessed to have not only an educated, but well informed individual that is leading our Department of Public Health, but we have one that actually cares to share with our community what is happening right now and how we can benefit from this vaccine. And so, without further ado, I want to bring to the stage our great director of the Illinois Public Health Department, Dr. Ngozi Ezike. Help me out there in virtual land. Go ahead and let's put some thumbs and some hearts out there. Dr. Ezike, thank you so much. And I just want to give the platform to you to just greet us at this time.
Thank you, Pastor James. And I'm just all those within the sound of my voice. Thank you. Blessings to all of you. Happy 2021. This is the year that we're going to put COVID in the rear view mirror. Glory to God. So I really want to make myself available. These are some of the best times of the day when I really get to reach out and talk to real people who have issues, that are struggling maybe with understanding all the information that's been put out. I mean, I am spending every waking hour trying to keep up with all the information that's coming out so that I'm ready when people ask questions. I'm never going to put out something I don't know. I'm not going to make something up. I'll tell you what the science says. And then if I have a different idea, I'll tell you what I think. But, I know everybody, this is a personal decision to get a vaccine, to get something injected into your body. You need to understand what it is, what it isn't. And so I want to make sure that people have the real facts. And then hopefully once you have the facts, I'm hoping you will get the vax. But, I'm not thinking that everybody has to think the exact same way, but I want to make sure that the decisions you are making are based on truths and not some of the fake stuff that has been put out there to really confuse us and actually make us fall prey to this virus that has killed Black people at 3 times the rate that it kills our Caucasian brothers. So, Black and brown people, we don't really, I feel like it's a very simple choice, but I want to hear from people so I can understand where people are coming from. So I don't want to talk too much because I might say a lot of stuff and it's not what you want to hear. That's not the question you were waiting to have answered. So should we open it straight up so that people can really engage and I can hear what's on people's mind?
Sure. Yes. And again, thank you for that great greeting to us. And we did, as many of you who are watching had the opportunity to send in your questions to us. And so some questions that we have tonight, and Dr. Ezike, let me again make it clear for those who are watching in the virtual space that she has not hidden from being able to answer any questions that you all have tonight. In fact, she has encouraged that you would ask those tough questions. So again, thank you for that and your transparency with us. And so to just kick off our conversation tonight, right here in the state of Illinois, we know that the vaccine has come to the area where we've been pushing it and encouraging people to consider it. But I think one of the questions that we have received from individuals is what actual vaccine will citizens be receiving, as many are hearing Pfizer, Moderna, or some others. Do we know exactly which one they will be receiving? Is it a combination of the two in regards to the vaccine?
That's a very fair question. That's a great way to start us off. So basically, there are only 2 vaccine choices. There's the Pfizer, the 2 manufacturers, the companies that have made it. The Pfizer vaccine came out just like a week or 2 before the Moderna vaccine. Nobody's going to have a choice. No, you don't get to say, oh, I want this one, I want that one. I did hear, like, this is cutting edge news. Nobody has been told this by me until today. So we just heard tonight that there is a 3rd vaccine that submitted their application to the Food and Drug Administration. So after the FDA reviews the application, there may be a 3rd, but as of today, there are 2 vaccines, the Pfizer and the Moderna. They both are super similar, both in their effectiveness, both in the science and the technology that they're using. So there's really nothing for anybody to start saying, oh, I want this one, I want that one. And in fact, even when there's a 3rd one, and I pray that there'll be a 4th and a 5th, that there'll be so much vaccine that you just need to get a vaccine. You need to get the dose and you need to get it as soon as you have the opportunity, because this is our best way forward. In addition to, okay, this is not instead of masking. This is in addition to masking and distancing and keeping your distance and really trying to avoid those large crowds, because half of the people who have the virus are not showing a single sign. So you're saying, oh, that person's safe, they look good. It doesn't matter. They still could pass the virus on to you. And again, Black people have been dying at 3 times the rate of their white brothers. So we need to protect ourselves, and this vaccine is a great way to start.
That's good. And so with that, what really, when we talk about the vaccine, what are the risks in not receiving the vaccine? And really, for some people who may be skeptical, what are the risks in receiving the vaccine?
No, that's a great question. I love how you framed it, because everybody's asking like, oh, I'm not sure about this vaccine. You shouldn't be sure about COVID either. COVID has not been playing with us, okay? 19,000 people dead just in the state of Illinois. Like, we were counting, when you look at the national news, they were talking about 4,000 Americans dying per day at the hands of COVID. So, you know, when you balance that risk and the benefit, and what's the risk of COVID versus what's the risk of the vaccine, I mean, for me, I think it's a clear choice. People are like, well, I really don't like needles. And I understand that. I'm not a fan of people injecting needles into my body, for sure. But I think about it like this. If you have COVID, and if you're not lucky enough to have a mild course and somehow you end up hospitalized, you're gonna have a whole lot of needles in your future if you're in the hospital. Let's be real. Like, there will be a lot of needles in your future if you end up hospitalized. And we don't want to, I mean, if it's one needle poke to avoid a lot of needles and a long hospital stay where people cannot visit you because of the COVID restrictions, I think I know where my choice is. And I made that choice. I just got my second dose. I'm keeping track of the days. Tuesday, I think today's Thursday. I got my second dose 2 days ago. And I was gearing up because people have said that second dose really can knock you, on your tail. I just had some soreness in the arm, but I have had, friends that said, oh, they got chills and they got a more intense reaction. They had to take a day off. So there's a range of symptoms and, feelings that can happen after the first and the second dose. But for me, I just experienced arm soreness twice with the first and the second.
So we're gonna kind of be going back and forth. So I'm gonna go to the actual live chat. And again, those of you who are watching us, please put your questions out there. We have Dr. Ezike here, so let's ask her. We have one question that has come from one of our viewers by way of YouTube, and a fellow soror of yours asked the question, how long is the vaccine's effectiveness?
Yeah, that's a super great question. We know from the trials that, it was effective at keeping people away from getting severely ill for 2 months because the trial was shortened. Let me just segue into that, because people are saying, like, how can the vaccine come out so quickly? Usually it takes years. How is it that we had it in less than a year? I mean, basically, the part that's missing is the part where you get to look at it and say, what happens at 6 months? What happens at a year? What happens at 4 years, 5 years? And basically, the decision was that we are in a global pandemic, the likes of which we have not seen in 100 years. We had people dying at the rate of 4,000 Americans per day. So if you have a vaccine that looks good at 2 months, and from previous vaccine science, you know that you usually have any significant bad effects, that happens in the first 6 weeks. So if at 2 months you looked good, then can you justify saying, I'm going to wait for the 5-year after effects and look at what happens while you have 4,000 people dying every single day in this country? We were clocking over 100 a day in Illinois alone. And so it's because of the severity of the problem that they were like, no, we're not going to do this 3, 4, 5-year. This works. We haven't seen any side effects. And we are going to get this out there because we need to start saving lives now. So that's one of the main reasons why the process was shorter than what it normally is. I think my soror's question was related to, and I went off on my tangent and forgot my soror's question.
That's all right.
What was she asking?
Vaccine's effectiveness. Yeah, just the vaccine's effectiveness.
Yeah. So the vaccine's effectiveness, I think we know the current vaccines are 95% effective. That's what the study showed, 95% effective at making sure that you don't have severe illness. I think they said that is absolutely like 100% effective at preventing, like death or severe illness, which is what we want. If you have, it's not guaranteed that you won't still get positive. And that's why it's still so important to wear the mask, because you could be fully vaccinated. And again, you need the 2 doses. So, I know you get some kind of protection with that first one, but to get to get towards that 95%, you have to get the second one too. And it takes a couple of weeks after the second one. So it's not about, oh, I got my second one and then I'm burning my mask. Like we're not burning masks. We still need the mask because you still might be able, to get infected. So you could have your full protection. You did your vaccines, 2 of them. You waited 2 weeks. You could still come in contact with someone if, you're not masked, they're not masked, they have COVID. They can still give it to you. You won't get sick and die, which is great. Hallelujah. But with you still having the COVID virus within you, you could still breathe on somebody who has not been vaccinated yet and make them sick. And, hopefully that doesn't happen, but they could become very sick and have very significant side effects, even go on to be hospitalized and die. So you don't want to be responsible for that. We want to take care of ourselves, and we also want to take care of our brothers and sisters. So we will continue to wear our mask and continue to be diligent and cautious so that we don't pass it on in case we do catch it. You might not even feel sick, so you don't even know that you have caught it, but you could still pass it on. But this vaccine is very effective. The flu virus, for comparison, is only 40 to 60%. And that was, the main, shot that we were still pushing on everybody every year, because we still thought 40 to 60% is better than 0%. And so if we have something that's 95%, we should not be walking, we should be running to get it.
Wow. That's wow. Thank you. We had another question to come from our virtual space, and that is, once you take the vaccine, saying that you've gotten both shots, is this something that we will have to take every year, possibly like the flu shot, or what's the I guess the consistency of it?
Yeah. So I told you I'm going to keep it real. I'm not going to tell you stuff that we don't know. We can't say for sure. It might be a situation because, these viruses, we're already seeing, you keep hearing about the variants, the out of, circulating in UK, Brazil, Nigeria, South Africa, blah, blah, blah. So we know that these viruses will start to mutate and maybe change. So will it be something like the flu where you have to get, an updated new vaccine, a booster every year? Maybe. We're still kind of on our first round with this, so we can't talk about what we're going to be dealing with, for the round 2. But right now, we think we have the vaccine. We think that the vaccines we have will be effective even against these variants. As new variants come around, will there be changes that maybe some of these vaccines won't be effective? Time will have to tell. So there's ongoing research. So the trials that happen to allow it to be authorized, there's still ongoing study to keep testing the vaccine against the new variants and see what we know. There's ongoing trials to figure out, okay, can we get some kids and see what's the deal with the kids? Can we lower the age, below 16, below 18? So a lot of stuff is still happening. It's not like they just like, okay, we're done. We gave it to you. We're finished. Ongoing research is happening every day to see what more we can learn about this.
And just kind of segueing into this piece, when we talk about our children, as you know, many of our districts around the area have been having the conversation. Many have already had plans in place, and some are even back, into the building. So when we talk about this vaccine, and many of our students have not been vaccinated, staff have, but we have been, in some regards, forbidden from our younger generation having it. What is the current conversation around the potential of the younger generation being vaccinated, and by them not having the vaccination at this point, what are the dangers that could happen in regards to them coming in contact with adults that may be infected?
Right. So they're in the same boat as most people are now, where they are susceptible. They could get infected. So that's why, actually, that's one reason to get the vaccine, is to protect kids that might be in the household who can't get vaccinated. So if you're in a home, with children, then you want all the adults around to be vaccinated. So hopefully, there can be more protection. But again, I mean, it's not 100%. It doesn't mean that you get vaccinated and you can't get, you can't get the disease. So we still have to have kids be careful. We still have to be all washing their hands when they're in school. I'm hoping that school is really promoting and ensuring and enforcing that kids are wearing their mask all the time. We're still not at a time where we should really be, mixing it up at large birthday parties with mixed households. Super Bowl parties, be careful, be careful. You're mixing it up with different households. We don't want that to be a super spreading football event on this Sunday. So everybody, let's play it safe. Everybody, phase 4, region 4 came into phase 4 today. So I remember sending the governor a message this morning. I said, region 4 got to phase 4 on the 4th of February. I said 444. So that's a good thing, but I don't want that to change because we just loosen up all of our strategies and, try to burn our mask and say, okay, restaurants are open, everything's open. Let's go for it. We still need to use common sense because we went through this before where we came out of the first wave and then went right back into it again in the fall. So I don't want to see another third wave before we finally kind of put COVID in the rearview mirror. So let's be sensible. I know it sounds crazy, but if you are going to be mixing it up in different households, and I'm saying you shouldn't, but everybody's not going to listen. If you are going to mix it up in different households, you really should be wearing a mask, outside of, pull it down to quickly have a drink, or maybe you can put your straw under your mask and sip your cold water beverage or whatever you're drinking. But we really have to do whatever we can to stay safe and not reverse. It is so sad to think that people with vaccines in the state, getting passed out now, coming into all the pharmacies, a third vaccine ready to come through. This is not the time to let up, get sick, and have something horrible happening when we're so close to getting vaccinated. Let's hang in there. Let's hang in there.
Yeah. So we know that with anything that is good and that's coming out, there are always those individuals who will, in some regards, try to taint what could be seen as a positive. And unfortunately, we have been seeing in many communities, and unfortunately communities of color, where these stores are getting vials of the vaccine and are charging people for the vaccine, or we're hearing that individuals are placing water to dilute it, to kind of stretch it. So could you kind of speak to the security and the safety measures when it comes to the vaccines that Illinois Department of Public Health approved sites, are distributing?
No, that's a great point, and I'm so sorry to hear that. I have said over and over, if anybody is trying to charge you for the vaccine, you better run, not walk away, because all of these vaccines were given completely free of charge to the state of Illinois. We are passing it on to local health departments and pharmacies and hospitals with no charge. No one is supposed to have any bill or fee or charge associated with it. Insurance, no insurance, documented, not documented. So I really, we've tried to give some suggestions to people who are vaccinating, properly, dispose of the vials and make sure that they're going to be taken away and disposed of properly. Because I don't want to see people saying, "Oh, look, I have the vial. This is the real thing," and then you don't know what they've put in it. But anybody that's charging you run away, because that is not a legit provider. And they probably don't even have real vaccine. And I don't want anyone to take any risks with anything that's been tainted or messed with in any way.
That's good. I want to go to our live feed. It was a great question that was raised. It looks like Vernell Payton raised this question, and I'm going to read it for you verbatim. So she says, I tested positive for COVID-19 in June 2020. I still cannot smell or I believe she's saying taste. I'm getting the vaccine, but don't know that I should be running to get the shot. Is it as immediate for me?
Okay, so now you've asked me the one question that I hear what you're saying. So let me tell you what CDC says. So you had it in June. What are we? It's February, right? So it's been 6-7 months. So the CDC recommendation is that if you've had the disease we know that you will have antibodies and protection for at least 3 months. It's probably more. I've seen lots of papers and research saying that people have antibodies and protection 6 months, 8 months, down the road. So, the CDC says officially, wait 90 days, then you can get it. Could you wait a little longer? Sure. Do I know exactly when your protection or your immunity will end? No. Will it last 2 years? I don't know. Nobody's had COVID for 2 years, right? So there's some questions that I don't have definitive answers to. This would be one. I mean, I guess, if somebody had, you had the symptoms, you had illness, you're saying you still have lingering symptoms, that would suggest that, you really had a true infection. And I'm hoping that your body mounted antibodies without actually drawing up, doing a blood test. I don't know for sure, but I don't want everybody to run out and try to get an antibody test before they get a COVID vaccine. So, I would recommend getting the COVID vaccine because it's not going to hurt you. It may add on, just make you have another, immune response to the immune protection that you already have. It can't hurt. But if I was rationing vaccine, I would put you at the back of the line because I would say, some people have no protection at all if they haven't had it, and you probably have some. But do get the vaccine when you have the opportunity. I'm hoping that we will be in the land of plenty soon, where there'll be lots of vaccine and that everybody can get a dose. Right now, I know some people are waiting because we don't have enough vaccine for everybody. But if you have the opportunity, please take advantage of the opportunity.
All right. And we have another, I think this is another great question that was raised by way of YouTube. And it says, are there additional precautions that are taken when given the vaccination if you are allergic to such drugs as penicillin?
That's a really, really good question. So we've got a very educated bunch here that's listening in, Pastor. So if you have had a history of an allergic reaction to an injectable, the only thing that is recommended is that we observe you for, instead of 15 minutes, we observe you for 30 minutes. Because if you had an injection and you reacted to it, so if they were injected penicillin and then you reacted to it, you would let the individuals know at the vaccination site. And let me just plug, because there is a vaccination site that happened today. I had somebody from my team, Dr. Campbell, there all day. He came down from Chicago and was there like 2 days ahead of time trying to make sure everything was good. And he said that it went really well at the Clyde C. Jordan Senior Citizen Center in East St. Louis. So anybody who got their vaccine, I heard over 400 people were vaccinated. So shout out to all of you for getting that first vaccine. But yes, so if you've had an allergic reaction where you responded to an injection, then you just get to be observed for 30 minutes to see if that reaction occurs. Every place that does the vaccinations will have the epinephrine, that EpiPen, to help treat you if that reaction occurs. But we have seen that the rate of those allergic anaphylactic reactions is like 1 in a million, right? 1 in a million. So that's very, very rare, but nobody knows who that one is going to be. So every site has to be prepared with the epinephrine and keeping everybody observed for either 15 or 30 minutes.
Now, Dr. Ezike, you mentioned about the communities of color, especially Black and brown bodies, where we are seeing a higher rate of mortality in connection with this vaccine. And so in that, how is the Illinois Department of Public Health ensuring that communities of color have an equitable access to taking the vaccine? And are we having the conversation about mass vaccination centers as an option throughout our state, especially in Southern Illinois, where we do see a large population of communities of color?
No, absolutely. So, there are two parts to that, right? So we can make vaccine available, and then it's still, how they say you can lead the horse to the water, but you can't force the horse to drink. So we have two issues that we're dealing with. We absolutely have to make the access. We have to make sure, that's why we had this site at the Senior Citizen Center today. We intentionally chose this area in East St. Louis because we know that there's a high, I specifically said that we have to go here because we have a high rate of communities of color, and we have had this region has had some of the highest rates of infection for the state, right? So when we divided the state into the four, the 11 COVID regions, and Region 4, which is, has St. Clair County, Madison, I think there's 7 different counties that make up the region. This specific region has case rates that are 50% higher than the state rate. So there's more burden of disease in this area. And so that's why it's so important that we prioritize vaccination in this area. The reason it took so long for Region 4 to come out of the tightened restrictions is because, there was lots of infection, because it was hard to get people out of the hospital. There were numbers of people in the hospital. There was still beds were tied up. So because there weren't enough open beds, we didn't feel comfortable loosening mitigation. So it's really a priority in this region. That's why we're directing the National Guard to help with vaccination sites. It's why we're going to make sure that more pharmacies in the area have the vaccine so that people have access, but we also need people to want it and go get it, And so that's why it's really important. Another important part of the plan is to make sure that we are having lots of conversation, lots of town halls, lots of radio talk shows to make sure that people not only have the access, but have the information that they need to make the decision, hopefully to get the vaccination. So it's why I will spend all my evenings talking with, Black churches, Latino churches, different faith groups, different organizations, because I want to get the word out. I have my other members of my team that are going out in different directions as well. We want to talk to as many people as possible. So it's not that they didn't have their answers, their questions answered. I'm hoping that we can accomplish that. I also want to refer people to the cdc.gov website. The IDPH website has lots of information too. But I know sometimes I like people to talk to me rather than to have to read stuff, off the internet.
Thank you for that. All right. Another question I want to ask, and this is really in connection with how we're talking about our Black and Brown communities. Is the state of Illinois tracking detailed demographic information about people who, are getting the vaccine, including their race, their gender, and age? And if not, are there plans to do so, especially considering, COVID-19 impacting Black communities?
No, absolutely. That's a great question. So everybody who's supposed to be giving this vaccine had to promise, right? It was part of the terms of you being a COVID vaccinator, is that you have to give us that information. For every single dose that you administer, you need to give the name, date of birth, address, race, ethnicity. So we have, that information, and we are looking at that to see, are all of our groups, in this state, is it, I don't want to create more, disparity. We have already seen how horribly this virus has treated Black and Brown communities, and we don't want to worsen the disparity more by not having the vaccine reach those same communities that have been hit hardest. But some of that is that we have to choose to get the vaccine because we are trying to make it available. And so we don't want to punish or coerce or force anybody, but we want to hopefully give people, access to the information, ability to ask questions, hear the concerns, and hopefully help people make what I think is the best decision to get the vaccine.
Thank you so much, Dr. Ezike. Just one more question I want to ask. We had a virtual question that came up in regards to bad heart. So it's saying, is it true if you have a bad heart, the vaccine will infect you?
The virus will infect you and have a bad time with you if you have a bad heart. So we have seen that there are certain medical conditions, those pre-existing medical conditions that many of us have, whether it's heart disease, whether it's, COPD, whether it's obesity, whether it's kidney disease, all of these conditions and others put you at risk for having a very bad time with COVID. And so it's the COVID that mixed with heart disease, a bad heart, that will be a problem, that you need the vaccine so that you don't get the COVID. Remember, the vaccine does not have the virus in it. The vaccine cannot give you the infection. The vaccine will not give you the disease. The vaccine will not give you COVID. Okay, but not getting the vaccine can result in you getting infected with COVID.
Thank you so much. And again, listen, we want to say thank you for taking this time to be with us. We know that you are busy, especially in this season of our pandemic. So listen, please just take one more moment to share any last words that you have with us. Again, encouraging us in this time.
Yeah, thank you so much. And I just appreciate you, Pastor, and the work that you're doing to get this important information out. I'm just I'm imploring, begging, praying that everybody will really take a very serious look at this vaccine. Look at the number of people in this country that have gotten this vaccine. There are tens of millions of people that have gotten this vaccine. If there was something, very untoward, you would have seen it. I know a lot of people have said, oh, this vaccine was created to take out Black people, to take out Latino people. Please remember that this vaccine throughout the country was given first to whom? To doctors and nurses and other people that work in the hospital. Everybody needs those healthcare workers. So to think that, there's a plan to take out all of our healthcare workers first and then use it, to take out Black and brown people, I'm not sure that makes a lot of sense. Sometimes I say, well, if you had said all Black people to the front of the line, you start first, I can understand you might be like, hold up, I'm not sure about this. But that's not it. And, it's really, I know we've talked about the Tuskegee study. People have brought that up a lot of times. Remember that in the Tuskegee study, that involved watching people with syphilis. And let me just clear that up. There was no injection of syphilis into the participants. I know that fact gets twisted a little bit, but there was still foulness that occurred. So they took individuals who had syphilis and they watched them as the syphilis, spread through different parts of their body, infected the heart, infected the brain. But the problem with this was that, somewhere in that study in the 1940s, they discovered that there is a cure for syphilis. So the right thing would have been like, oh, we don't have to just keep watching you. We can give you the treatment. We can give you the penicillin so that you can cure the disease instead of keeping it from you and just watching you get sicker and sicker and infect your loved ones. So that was what was done wrong, is that they withheld treatment. And so when I think about this situation, there is a preventive measure that we want people to have, all people to have. And so I don't want anybody to withhold that preventive measure from themselves. So please continue to look up the information from credible, trustworthy medical and public health sites. Talk to your physician, talk to your doctors and nurses, talk to people who say online that they got the vaccine and it really wasn't that bad. I really want all of us to put this horrible nightmare, this mass casualty event behind us so that we can think about other issues that are still burning that we need to take care of. And so we need to be as healthy as possible. I don't want to lose another life. And we can do that by masking up, continuing to social distance, get tested while you're waiting to get your vaccine. Remember that you still have to get tested. And then please get the vaccine as soon as you have the opportunity. And after you get the vaccine, encourage somebody else to do the same. Thank you so much for your attention. I hope you'll have me back so that I can share any updates in the near future. But please stay safe, everyone. God bless.
Thank you so much again, Dr. Ezike. And listen, you are always welcome here at the Church for All Generations. In fact, when it gets a little warmer and we're back outside praising God, we're going to invite you to come and be with us and to see St. Louis is in its trueness. So thank you again for being with us. Virtual space, come on, put those hands together, send those hearts, those loves, those likes, as we thank Dr. Ezike again, our Director of Illinois Public Health. I'm telling you, how many directors of public health for the state is taking out time to have sessions to come virtually to our congregations and share with us this important information. In fact, we have people from all over this country that is watching. And guess what? Right here in Illinois, we are setting the trend of how you have those conversations. In fact, Dr. Ezike told us, you heard it here first tonight, that there is the potential of a third vaccine that's coming. Whether that comes today or tomorrow, please, we want to encourage you to strongly consider getting vaccinated, especially if you are one that is above the 65 and older age right now in our Southern Illinois area, healthcare provider, whomever. Please consider taking this vaccine, as it might not only save your life, but the lives of those that are around. I want to also say this. Thank you so much to Miss Marilyn Green. I have to give her a shout out, who works with our Illinois Department of Public Health, especially in our southern area. Thank you so much for your help in leading us into this space. We celebrated today earlier as phase 4, region 4 is now back in phase 4. Now, that doesn't mean for us to go crazy and to stop wearing our mask, but it is to show that we are progressing as a state and we're progressing as a country. I also want to thank Juana as well for the connection and providing us this space to have Dr. Ezike. And most importantly, we thank you, the viewers, for watching us. And I pray that you have been blessed by this time tonight and encouraging your family, your friends, the skeptics, whomever, to come and to watch this live, because I guarantee you that they will be encouraged to strongly consider getting the vaccine. Well, listen, this has been our Thursday night experience. Macedonia and our friends, join us this Sunday, 10:15 a.m. right here on the virtual space by way of our Facebook, our YouTube, or our website, and worship with us as we have a great time in the Lord. In fact, Lady James and I are starting a series this Sunday entitled Teach Me How to Love. In fact, before we end tonight, join me in prayer. Our God, who is our creator and our sustainer, we thank you. We thank you, oh God, for affording us this great opportunity for dialogue. You told us in all of our getting to get understanding. And so tonight, I pray that minds have been put at ease and hearts and anxiety has been lessened as they have heard the words of Dr. Ezike and being assured of what this vaccine provides to our communities. God, I pray that you would just continue to sustain us and cover us in this time. And most importantly, to those who have been infected by this disease or families that have been impacted by this disease, I pray, God, that you would strengthen them, that you would hold them in the hollow of your hand and give them your peace. God, we just bless you tonight and we thank you because we know that greater days are ahead and that this pandemic that we are in right now will be behind us one day. It's in Jesus Christ's name that we pray. Amen. God's blessings to each and every one of you. On behalf of Lady James, the disciples of the Church for All Generations, and myself, we say, have a great night. And remember, you are a gift from God. Be blessed.